I was big into exercise. I was a vegetarian at the time. I was a runner, and I just was interested in health. And so I went to medical school, and I kept thinking, when are they going to talk about health? And they never did. It was just basically disease and pharmacology. And they did do chemistry, biochemistry, physiology, but really, I didn't get to use it in conventional practice. I was a family physician for 10 years, and I was also the medical director of a nursing home. I really saw way too many elderly people on polypharmacy. I just thought there's got to be a better way to deal with chronic illness. I'm a Kansas University graduate, medical school, and then I met Dr. Reardon while I was doing my internship in Wichita. I just happened to run into him again at another lecture, and he invited me for lunch, and the rest is history. Dr. Reardon was considered eccentric, as most medical mavericks are. He wrote a trilogy called Medical Mavericks. He wrote it because he made a number of discoveries here that he thought the medical world would be excited about, and instead he was shunned. The word vitamin seems to trigger a lot of negative, bias type thinking, and frankly, I would rather we call it IV ascorbate or something different. But the little mnemonic IBC, which just kind of rolls off the tongue, is what has stuck. We'll probably stay with that, but I always have to tell people it's about the molecule ascorbate, what a unique molecule that is, and why giving higher doses is really simply we're now doing what all the animals do. They make their own vitamin C in higher doses when they're sick. When the British faced the Spanish Armada, the reason they won is because they had the lime. They had the lime juice, and their sailors were not so terribly tired because they were sitting out there before they started fighting. And all the Spanish naval people got sick, and they were weak, and they couldn't fight. So the undermanned British Navy won because they had lime juice. Dr. Stone wrote a book called The Healing Factor all the way back in 1976. He, in that book, goes so far as to say that human life on the planet, and I mean on Earth especially, could not have survived without vitamin C. The vitamin C molecule, when I see cancer patients or chronically ill patients, I typically show them the glucose molecule and the oxidized vitamin C molecule. They're incredibly similar. Where it really comes down to, and what's been really fun to discover, is that the real key to health is mitochondrial functioning. It's like the intracellular biome. These are bacteria that millions and millions of years ago, one little bacteria got eaten by a bigger one, phagocytized, and instead of being digested, it formed a symbiotic relationship, and it formed a second membrane around it. Mitochondria, which make up 10% of the body weight, they are the source of our energy. And there's a very important distinction that happens when the prokaryotic cells, which were the original single-cell organisms, learned to be able to make ATP energy with mitochondria. There was a 19-fold increase in the energy efficiency, and it really brought about the whole era of multicellular organisms. When you take vitamin C as a powder or as capsules, you only absorb about 30% of it. There are transporters in your gut that have to transport it across the gut membrane. But the sicker you are, the more actively these transporters work. Cathcart, who was a successful orthopedic doctor, made all of his money designing a special hip replacement, and being independently wealthy, he got bored, and so he went back and started taking care of college students. And when they would come in with monos, he would just say, okay, instead of taking 1 or 2 grams a day, he would say, I want you to start out with 1 or 2 grams every hour and keep escalating your dose until you start to feel better or until you get diarrhea. Well, the average listener probably, and it varies a lot from one person to another, but if they were to do that little experiment, let's just say take 1 gram every hour, maybe about 4 hours or 5 hours into it, they would have to be running to the bathroom. Cathcart could get his very sick mono patients, they could take up to 10 every hour for like 12 hours, 120 grams, and even more sometimes. This pointed to a very interesting phenomenon, and that's when he understood that Dr. Stone had basically said the same thing, that when animals, and if you take the goat is the champion. The goat can make 12,000 a day, 10 or 12,000 a day, but if it's sick, it can make 100,000 milligrams of vitamin C a day. And that's equivalent to what we are giving to very sick cancer patients, for instance, or infectious disease patients. We give it as an infusion because to sit there and take tablets in every hour, it's not necessary if you have access to IV vitamin C. A lot of times I'll tell people it's how much your bowels will let you take. People have things to do in their life besides sit around and take vitamin C, especially if they're not all that sick. If you're sick, you're very motivated to take vitamin C. The common cold, which is really a misnomer because a really bad cold, you get pretty darn sick. You could probably easily take 40 to 60 grams a day. All these studies said vitamin C doesn't work for the common cold. They all were using 500 milligrams 3 times a day. It's a very individualized thing as to how much vitamin C you're going to need, and it depends upon not only what disease you've got, but like if you're talking about cancer, the early stage of cancer may not need as much as the late stage. The late stage may need a higher dose. And then we're also in the process now of looking into continuous infusion. We have an inventor who has developed a pump that you can wear around your arm, and it will give continuous infusion of intravenous vitamin C over a 2-day period. And we think this goes back to the original research that was done by Linus Pauling and Ewan Cameron. Everyone thinks they gave 10,000 as an IV drip over 20 minutes, which would be easy to do. But the answer is these people were hospitalized, and so they were given their 10 grams over a 24-hour period. It was continuous infusion. And Pauling and Cameron had, on the average, 4 to 5-fold increase in survival on just 10 grams. And they had a number of people that survived 20 times what the controls did. The whole theory of chemoresistance is where you give chemo or you give high-dose vitamin C and it kills the most susceptible cancer cells. Who's left over? The strong ones. And so you're basically selecting for resistant strains of cancer. Dr. Abram Hopper was another orthomolecular giant. He had a very successful study where he was giving 20 to 30 grams a day of just vitamin C ascorbate, along with a number of other nutrients. And he had a very high success rate. It's not just a question of vitamin C. It just turns out that vitamin C is a very powerful treatment. But even Dr. Reardon said you never want to base your therapy on vitamin C alone. We call it the perfect adjunctive therapy. I think vitamin C could be very powerful by itself, but there are so many cancer patients suffering from the side effects of their chemo. The chemo's not working, and there are a number of places around the country like University of Iowa, Cornell, Jefferson College. They're doing IV vitamin C plus chemo, and they're able to reduce the dose, and they're able to get better outcomes with fewer side effects. And it's a win-win situation. I'm not a big fan of chemotherapy, but if you're one of these patients that all of a sudden discovers they have stage 4 pancreatic cancer, that is a very life-threatening situation, and it should be really all hands on deck. You use whatever resources you can to get back on top of that thing. High-dose vitamin C is good for your healthy cells, but it kills cancer cells. This was the whole excitement and premise back in the 1990s when Dr. Reardon did what's called the RECNAC research. RECNAC is cancer spelled backwards. He was going to reverse the trends in cancer with IV vitamin C. There's now 12 quality of life studies supporting IV vitamin C in advanced cancer care. So there's no reason in the world why people shouldn't be getting it. Even if they're getting full-bore chemo, there's no chemo that has been shown to be interfered with by vitamin C. They tend to work synergistically, and you can use lower doses of the chemo with less side effects. So really, all of this points to the fact that vitamin C is an ideal adjunctive therapy for cancer cell patients. A lot of people take extra vitamin C just for a sense of well-being. It supports the adrenals. It helps you make good collagen. There's some research showing that it helps with endorphins, so your sense of well-being is better. It definitely relieves pain in cancer patients.